A very good morning and my greetings to everyone. I'm Dr. Ritu Tiwari, post-MD PhD scholar in Department of Physiology, KGMU, Lucknow. And today I would like to report on newer insights in nutritional supplements and herbal treatment for polycystic ovarian syndrome. So in 1935, the PCOS was first described by Steen and Leventhal as a syndrome manifested as oligomenorrhea, obesity, hirsutism, and enlarged polycystic ovaries. So it is an polygenic and multifactorial disorder. The effective approaches to nutrition and exercise improves the endocrine features, reproductive functions, as well as cardiometabolic risk profile. So the recent studies allow us to make recommendations on macronutrient intake. Fat should be restricted to less than 30% of total calories with low proportion of saturated fat. A well-known and famous diet is Mediterranean diet is an anti-inflammatory dietary pattern rich in complex carbohydrates, fibers, and high in monosaturated fat. These all are high fiber foods, especially the oat, lentils, almonds, strawberries. Around 5 gram of fiber is present here. So which food should we all limit or should we avoid? The food high in refined carbohydrates, sugary snacks and drinks, inflammatory foods like processed and red meats. Moving on to the nutritional supplements and herbal treatment of PCOS. Green tea, which also known as Camellia sinensis, it helps us to reduce weight, decrease fasting insulin. It also decreases the level of free testosterone, which is known to increase in PCOS patients. A lot of work has been already done in this field and published in PubMed Central. The second agent is inositol. Myoinositol was classified as a member of vitamin B complex. It is present in fruits, beans, grains, and nuts. It is a component of inositol glycans, which are secondary messengers in insulin signaling. It improves the insulin sensitivity and decreases LH as well as the LH and FSH ratio because this ratio is increased with the PCOS patients. It decreases the level of testosterone also, and it does have role in hormonal synthesis of ovaries and improves ovarian functions. Myoinositol plus declinoinositol. The combination is beneficial than either alone. It improves metabolic parameters more than myoinositol alone after 3 months of treatment in overweight women with PCOS. It also improves the lipid profile. N-acetylcysteine, NAC. It is an antioxidant and amino acid. Derivative of L-cysteine, an essential precursor of glutathione. NAC reduces the inflammation, improves menstrual regularity, as well as insulin resistance. It lowers the cholesterol, triglyceride, and testosterone as well. Coenzyme Q10. It is an fat-soluble natural vitamin, effective antioxidant. It protects the ovary from oxidative stress. The combination of coenzyme Q10 and chlorophyll citrate in treatment of chlorophyll citrate-resistant PCOS is commonly used. It improves the ovulation, metabolic, and endocrine indices. Omega-3, a new drug for PCOS. Immune regulation, insulin sensitivity, cellular differentiation, and ovulation. It's helpful in all these conditions. Reduce the excessive oxidative stress caused by folliculogenesis disorders and hyperinsulinemia in PCOS. It reduces the inflammation and pro-inflammatory cytokines. It also helps us to reduce the cholesterol absorption, LDL-C synthesis. Fenugreek is found in every kitchen, known as methi. It regulates the effect of insulin on ovarian androgen biosynthesis, theca cell proliferation, and endometrial growth. It improves the insulin-mediated glucose disposal. It is a rich source of vitamins, minerals, and antioxidants. And how we use it? A fenugreek seed extract, which is known as furocyst, 2 capsules of 500 mg per day is available. Insulin sensitizing compounds are saponins and flavonoid, and they decrease the LH-FC ratio. It also helps in reduction of ovarian volume, which is increased in PCOS more than 10 cc, and follicular cyst size, because there are multiple cysts are present in PCOS patients. When we see the USG, significant improvement in menstrual cycle. Cinnamon. Cinnamon is an herbaceous plant. Different flavonoids and polyphenols isolated from cinnamon have free radical scavenging activities and antioxidant properties. It also improves the lipid profile, improves the menstrual regularity, and 1.5 gram supplementation for 12 weeks is recommended. Chamomile, it's an ancient medicine which contains the phytosteroids, coumarin, and phytosterols. It has impact on GABA neurotransmission, and it improves the LH peak and trigger ovulation. Now the flaxseed. It is renowned for omega-3 fatty acid content, richest source of dietary lignin, decreases the androgen levels with concomitant reduction in hirsutism, and also normalize the lipid profile. Now the silk marron milk thistle extract. It is an anti-inflammatory substance. It helps in significant reduction in inflammatory markers and changes in follicular layer thickness. And it is available in 150 mg doses. Curcumin, it reduces the testosterone level, significant increase in level of estradiol, reduces blood glucose level and bad cholesterol, and increase in the level of protective antioxidant enzymes like catalase, glutathione, and suppressor mutase. Thank you so much for listening to me.